With health insurance, you and the insurance company share your medical expenses. You pay for some, and the insurance company pays for some. All plans have a limit to how much you pay per year. This is called your out-of-pocket maximum. Let's take a look at how cost sharing works with our tiered network plan, Dakota Blue. You may have heard of a network. It's the group of doctors who've signed on to accept Blue Cross Blue Shield coverage. Typically, a doctor or hospital is either in-network or out-of-network. A tiered network is different. The network is divided into 4 levels. In each level, costs to get care are different. Tier 1 is the preferred network. It includes doctors from one main healthcare system where you get the lowest out-of-pocket costs. Tier 2, the enhanced network, includes other North Dakota providers who accept Blue plans, but you pay slightly higher costs. The standard network includes Blue Cross Blue Shield providers outside North Dakota, but you'll pay even higher costs. If you are referred to an enhanced or standard provider by a preferred provider, you pay the same as Tier 1. And the 4th tier is non-participating providers, any providers who don't accept Blue Cross Blue Shield health plans. Costs are highest in this tier. Our friend Chris is going to help us demonstrate cost sharing with a tiered network plan. Hey, Chris. The costs and figures you'll see are for example only and may vary. With a tiered network plan, during Phase 1, Chris pays most of her own healthcare costs until she meets her deductible. However, there are a few exceptions where her plan pays some expenses right away. The second phase is coinsurance, or the cost-sharing phase. And if Chris reaches her out-of-pocket maximum, insurance pays all her covered costs for the rest of the year. Tiered network plans cover preventive care at no cost. Okay, Chris, it's time to go to the doctor and use your tiered network health coverage. Chris visits a preferred network doctor who orders lab work, tests, and a generic prescription medication. The doctor visit costs $450, but Chris's portion is just a $25 copay. The lab work and tests cost $1,350, and the doctor orders a generic prescription, which costs Chris just $5. Chris's copay doesn't count toward her deductible, so after the copay, her expenses are $1,380. With this visit, Chris hasn't met her $2,000 deductible, so insurance doesn't kick in yet. She pays the full amount. If Chris's Tier 1 doctor refers her to a Tier 2 provider, it's still covered the same way as Tier 1. But if Chris chooses to see a Tier 2 provider on her own, costs will look more like this. The doctor visit costs $450. The lab work and tests cost $1,350, and her generic prescription is still just $5. The total cost is $1,805. The lab work and tests go toward both the deductible and out-of-pocket maximum. The prescription fee only goes toward the out-of-pocket maximum. When using this network, Chris's deductible goes up to $3,000. She pays the entire amount out of pocket. Clearly, Chris gets the best value when she sees doctors in the preferred network, but she still has other choices. The thing to remember about a tiered network plan is this. It offers significant savings, especially within your preferred network or if you were referred elsewhere by your preferred network doctor. Is a tiered network plan right for you? Is there one available in your area? Our agents can help answer that and all the other questions you have. Contact an agent today or get started online with Blue Cross Blue Shield of North Dakota.